There we go. This is how normally I'm running, about like this. I've got my arms out. Like I said, after about an hour, it was getting excruciating pain just going across my back. And he's fixed all that. As long as that's fixed, I'm ready to go. "30 years ago, I used to run motocross, cross country, did a lot of different things. But one of the biggest things I did was had a bad motorcycle wreck during that, and did an end over the handlebars, and basically planted my head straight into the dirt, and it jammed top of my neck, messing up 3 herniated discs. So I've been dealing with that for 30 years. Seems like a long time for me once you're living it. And finally, it just got to be so bad at the end, especially when I go to drive the RV. As soon
2, 1, you're live.
All right, Dr. Duke Majan, and it is August 18, 2021. We are doing our second surgery for the day. It's a live broadcast. We're streaming over Facebook, YouTube, and Twitter. Our patient has 2 bad discs in her lower back. They're called herniated discs, and she's having back pain and left-sided pain, and we're going to go in there today and repair them. All right. Of course, she's awake in the beginning, Sean, and we'll keep her awake for a little while until we are ready. How's blood pressure? Yeah, we need... Yeah. So for me, it means I have to wait. That's kind of what I'm hoping before I come. You guys have it ready. All right. So while we're waiting, our patient has 2 herniated discs. Did you show them the MRI?
Yes, I'm showing the MRI.
All right. So at the bottom, you can see the L45, L5S1 discs have annular tears with herniations. They're more what we call a bulging disc, and they're causing her lower back pain and her left. Are you having pain down your left leg? Is that what you typically get? Pain down the left leg, sciatica. That's why we're on the left side. So we're going to go in with a small incision and a tube, and we're going to remove the herniation, and we're also going to clean up the tear through which the herniation came. And that should allow the disc to heal into a pain-free state. All of this is done naturally without any screws or rods or cages. It's a new technology that's not yet available everywhere else. It's going to be a while. And the patients don't have to have general anesthesia. They get to be put under propofol sedation for the procedure. So there's a much faster recovery and honestly safer for the patient. Num num. So I do want her blood pressure well controlled. People who use aspirin or any kind of an anti-platelet medication that inhibits the platelets from binding are at higher risk for bleeding. We've asked this patient to stop her aspirin, and she did a while ago. Shot. Last week, was it? Lateral. So the only problem is, even if you stop all the aspirin and blood thinners, if the blood pressure is too high, then anytime you nick a little vein, they're gonna bleed a lot. The patient's gonna bleed a lot, so we don't want that. All right, we need to get 5-1 cleaned up. It looks like you're wagged inappropriately. Maybe my side is south. Should be more north. The whole base needs to come south. And a lot of patients with spine issues do have scoliosis. That's normal for them to develop it when they have a damaged disc. It's not normal to have scoliosis, but it's normal to have scoliosis when you have a damaged disc. What do you think, Jordan? Well, I think that's worse too, but you think we need to wag my side south? Are we going the wrong way, you think? I don't think it's horribly off. You can see the iliac crests are pretty close. I think you've got a little bit of orbital issue. Let's see. It's not far. Actually, it's not far. But the sacrum concerns me because that thing, I can't really see the foramen at 5'1". And let's try a little more or less orbit to get the... I almost feel like that's better. Well, maybe not. Let's see. Try the other way. Not too much. It's got to be very small movements. Otherwise, we get lost. I can't tell if that's better or worse. I think you moved a little too much. Yeah. Let's try a little wag. Bring my side south. Let me know when the blood pressure comes down. Local. You doing all right, ma'am? You feeling okay, miss? Are you comfortable? As comfortable as you can be for having surgery, right? All right. We're going to put you to sleep soon, but I need your help in the beginning. That's the iliac crest. Shot? That light is like right in my eye. All right, give me some wag on. Let's just wait for Rita to come back. Okay. Yeah, move it to you. Yeah. That's better. Now I can see. It's not blinding me. All right, I think we got an orbital issue now. Lock the wag there and try to bring me down and you up just a little bit, probably about a degree or two. Start with 1 degree. That's better, I think. Isn't it? No, it's worse. Never mind. It's hard to say. Look at the iliac. Try the other way. I think there's some scoliosis at 5'1". That's what we're seeing. Try the keep going. That actually, to me, looks better, right? Even though the sacrum, the sacral wing is off. All right. Shot. Shot. I need to be a little bit lower. And we got our iliac crest there. Shot. Shot. That's better. Shot. Are you comfy? Ma'am? Shot. All right, AP, let's see where we are. We'll come back to that view. You're doing fine, by the way. Everything's going well. All right, so I'm 2 centimeters off there. Let's go back to a lateral. We have to get into the disc. We're not so far away there. Shot. Shot. She's doing great. Like, she's being really good. Shot. Any pain? Where? Your back or down your leg? In your back? AP. Alright, so I can see the pedicle of 5 nicely. I see the end plate, the top end plate of 5, the bottom end plate of 5, and we're kind of looking down the 4-5 and 5-1 disc nicely. So I feel like we're low in the foramen. And where's my lateral view? Don't worry, just bring me back to a lateral. Are you comfy? Where do you feel that? In your back? AP. So we're right at the back part of the disc on the side, back side of the disc, which is where we want to be. I just want to make sure we're not too far lateral. Because what I feel is I believe the herniation there. Looks like we're right near that. Let's see. Lateral view. All right, give me one more AP. I think we might have gotten it. All right, good. Give me a lateral view. That looks good. Perhaps lucky. Knife. Knife, knife. Knife, knife. Yeah. We're ready to make a skin incision. Now we'll see how that looks on the discogram. We've already given her some numbing medicine. We make a 7mm incision. This is going to be to access the next disc up, which is L45. So this procedure really starts out looking a lot like a pain management procedure. This is like a little wag and a little orbit. Maybe even a degree of each. It's not bad. Shot. The wag we're off. No, the other way. That's better. Where do you feel that, Shot? AP? I think I'm on the facet, the superior facet of 5 on the left side. That's what it feels like to me. That looks really good. Really good. You okay? Where do you feel it, dear? Okay. We're almost done. Just your back, right? Can feel the tear and the herniation. Shot. Are you comfy? So we've accessed both discs. I just want to make sure we get a good discogram marking pin. So today we're going to be fixing 2 discs, L45, L5S1. So if you look deep inside the back, there's one disc right about here. That's the L45. And another one down here. And that's the L5S1. And she has tears on the side, and that's where all her pain's coming from. That's what we're going to be fixing. Are you okay? Comfy? How bad is that on a scale of 1 to 10? How high did that go? That's a 9. All right, interesting. It's leaked out so much. It's even come backwards. She has had surgery before. You could see it. That's all the scar from her prior surgery. AP, please. So we did a discogram. I injected the dye into the disc, and the tear in the back of the disc is so big, all of it gushed out and went around the nerve root and then leaked out through her old incision. Watch your hand. Yeah, look at that. Interesting. Yeah, that's where her surgery was done before, so it's gone into all the scar tissue along the side of the spine. You okay? And how high do we say it went? 9. Was that your typical pain, where you typically get pain? Yes? All right, so that was a 9 out of 10. Okay, and
4, 5, we got 4, 5.
that was 4, 5, 9 out of 10. Let me have some more dye. Take that. She's had prior surgery. When was your back surgery? Stay there. 2016. Shot? Oh, yeah. How about now? Any pain? How bad is that on a scale of 1 to 10? Huh? 10? Is that where you typically get your back pain? Let's get a lateral. So the 5-1 is a 10 out of 10. 4-5 was a 9 out of 10. All right. When you watch you get to go to sleep now. Go ahead and count from 1 to 100 out loud, okay? Count out loud from 1 to 100. Nice and loud so I can hear it. You might feel a little burning in your arm. That's just the medicine going in. So this disc up here was a 9 out of 10 pain, and the disc below is a 10 out of 10. So these are painful discs. These are the discs that are causing her pain. And the tears in them are massive. They're huge. So my job is to go in there and fix them, so she doesn't have this pain anymore. And I think it's going to work. I feel really good about it, Shot. Because number one, I fixed thousands of discs that are herniated that cause pain, and I know this procedure works to eliminate the pain. Shot. Now, we looked at a group of patients that we had done laser surgery, Duke laser disc repair, that was over 5 years ago. And the average for the group was 6 years. And the average pain relief at 6 years of follow-up, 6 years after the surgery, was 95% elimination of back pain and 95% elimination of leg symptoms. So I'm taking the guide wire, leaving the guide wire in, taking the needle out of L5S1. As you do this, you want to make sure you don't advance the guide wire any further than I have. So I'm going to pull it back a little bit, Shot. Even pull it back a little more. There's really nothing in front of the spine right there at L5S1 you got to worry about. Immediately adjacent to the spine in the midline. So there's a bifurcation of vessels that happens above it. All right, so I'm going to be passing through that scar tissue. You see that? All that dye leaked out? Good. That's good. We're going to pass through it. I'm going to keep an eye on my guide wire. I can feel the scar tissue and the muscle. One of the issues with her was I encountered a very high iliac crest, Shot. And the iliac crest, folks, is, you know how you have these hip bones? They actually make a curve below the skin. You can actually feel the bone. And hers goes pretty high like this. You know when you look at a skeleton, dancing skeleton, you see those nice bones back here? It's kind of in the shape of a heart almost. So I had to go just above it. You can't go through the bone, so you got to go above it. So it makes it a bit more challenging to do. This is why a lot of surgeons don't even do L5S1 surgery endoscopically, transforaminal. They just do interlaminar. So basically they go between the lamina right here, but they have to drill away part of the lamina. She okay? Perfect. She's not responding to me, so I'm happy. Blood pressure's good. Yeah, perfect. That's very nice. So obviously what I worry about is spontaneous, obviously like an epidural, right? Or intramuscular bleed. Epidural could be bad. We'd have to operate emergently. But an intramuscular bleed can cause pain for 2 months or more after the surgery as the blood clot breaks down. So I try not to have any bleeding at all. It's not that we're worried about this tiny amount of blood loss. That's not the issue. Losing 5 milliliters of blood is nothing for a patient. But when you lose that blood into the muscles, it's going to cause inflammation for 2 months after surgery. And the patients will have back spasms, and they'll have really just a lot of discomfort. And I don't want them to have that pain after surgery. So we try to keep the blood pressure down to avoid intramuscular hematoma after surgery. Now the other place we can get a blood clot that's bad is the epidural around the nerves. And an epidural hematoma that expands is an emergency. We have to open up the back, do a laminectomy, and suck out the blood clot. And we're certainly capable of doing that. This is an outpatient surgery, by the way. This is not being done at the hospital. It's done in a surgery center. We've been doing outpatient spine surgery for 9 years now. Sean? Right here at Duke Spine Institute. Complex spine surgeries. And sucking out an epidural hematoma is nothing. It's easy to do. That's not the issue. The issue is we don't want to have that complication to begin with. I'll need it back. So that's why blood pressure control and making sure the patients don't have antiplatelet therapy or anticoagulation on board, shot. And there are a lot of things that cause the blood not to clot, okay? And we call those anticoagulants. But a lot of people don't realize the first step in forming a blood clot is the platelet plug. And the platelet plug is made up of platelets, basically little pieces of cells called megakaryocytes formed in the bone marrow. And these cells break off pieces that are called platelets. And the platelets, anytime there's a tear in a blood vessel, the wall of the blood vessel causes the platelets to bind and form a little platelet plug, okay? And so things like aspirin, Motrin, any kind of non-steroidal anti-inflammatory, they prevent the platelet plug from forming. Hey, come on. I don't want this on my shoes again. It's like cascading, huh? Yeah. We want to channel it into the bag. Into the bag. Good. Thank you. So things like ginkgo biloba, fish oil, turmeric, these are herbal medications, herbal supplements that actually have an effect on the platelets being able to bind to each other. And that's why people have used them for 1,000 years, is that they reduce the risk of cardiovascular disease and stroke.
Thank you.
However, they also cause bleeding during surgery. So that's what I have to worry about, is the bleeding during surgery. So I tell all my patients to get off of ginkgo biloba, fish oil, and turmeric for at least 7 days before their surgery. Get off the aspirin, ibuprofen at least 7 days before surgery. Preferably longer, but because the truth is the aspirin is not, the aspirin is cleared out of your system, all right, 1 week after you stop it. But its therapeutic effect is not. So aspirin causes an irreversible binding and conformation change in the platelet structure so that the platelet can no longer do its job. And it takes 30 days for your body to recycle the platelets and create new ones. So if you really want zero aspirin effect on platelets for surgery, you need to wait 30 days from the day you stop aspirin. But I don't think that's necessary most of the time. Now you can look at the incision I made, and there is a little more oozing than I normally would get in a patient who doesn't take aspirin, but it's inconsequential. In other words, it's not significant enough. And you got to remember, these surgeries are not elective surgeries, even though we call them. They're actually, we're dealing with patients who are in severe pain and have no alternative to get rid of their pain but to take dangerous narcotic drugs. And also, a lot of times these patients have nerve damage. So I'm dealing with unpinching a nerve because of stenosis or narrowing with the pinching of the nerve, as well as, and preventing nerve damage, as well as eliminating back pain. So I'm dealing with two issues, and making the patient wait longer is not good. What do you think chronic pain does to your mind? Terrible things, okay? Just ask anyone who's been unhappily married for years. Oh my gosh, nobody is laughing at all. This is horrible. I'm going home. Here, thank you. Louise, thank you. I'm starting to feel inadequate as a comedian. This is terrible. My anesthesiologist doesn't even laugh at my jokes anymore.
I think you're talking about me.
No, I'm talking about these poor people who live in pain and suffer needlessly. And I don't want to prolong their suffering any longer. So even though the effect of aspirin on platelets is not finished after a week, I still feel it's safe to proceed because I don't want to prolong their agony and suffering. Now look at that right there. See all that little bit of bleeding there? That just reminds you that this is an inflammatory disease. Okay? That bleeding is really capillary bleeding from granulation tissue. It's not arterial bleeding, it's not even venous bleeding. It's capillary bleeding. Goes along with the pathology. By the way, if you really want to make a difference in medicine and you're a doctor, you really need to do well in medical school, study hard, understand histology, the study of tissues and cells, anatomy, and pathology, and pharmacology. Those are probably some of the more important courses. Okay, biochemistry too. Shouldn't leave that out since I'm a biochemist. But if you understand biochemistry, you can understand pretty much everything that goes on in the human body. Because biochemistry is the heart of everything. Bio is for life and chemistry. It's the chemistry of life, basically. That was my major in school. I was a biochemistry major and a chemistry major. So I couldn't get enough chemistry, so I did a double major, basically. And it wasn't too hard to do, to be honest, because I'd already taken so many classes in chemistry. But anyone who wants to make a difference in healthcare and medicine, you know, from a biomedical standpoint, I think a really good understanding of disease and normal versus abnormal is very important, especially on a molecular and biochemical level. Okay? It's my advice to the stars of tomorrow. All right, there's the tear. And again, it's vascular. Remember we talked about this last surgery. Rubor, calor, dolor, tumor. Swelling, redness, heat, and pain. Those are the cardinal characteristics of inflammation in the body. And this thing is inflamed. It's red, it's swollen, it's painful, or she wouldn't be having the surgery done. And it is hot. A hot disc. Yeah, I like that. We can call it a hot disc. I know someone's wheels are turning. Can we do MR thermography and figure out what discs are inflamed, right? Wow, what a concept. I wonder if we can do that with our new MRI we're getting. That MRI is incredible, huh?
Yeah.
Do you know about the new one?
No. Do we have any?
Oh, we have a new MRI coming.
Really?
When? Well, I already bought it.
Oh, okay, but it's not here yet.
No, no, no. We need a big enough room to put it in.
Oh.
We don't have that here.
So, Monica's rep.
Yeah. Friend?
Rep.
Rep.
Yeah, she sent me a quote of $17.
$1,000.
Yeah, anesthesia. Oh my god.
What anesthesia machine are we looking at?
So this one is the one that I.
What's it called?
Huh? This one is oh my god. What's the brand of this one? It's Aexia or what is it? No, it's with the E.
What's the best anesthesia machines?
What do you think?
What's the best? Oneida? Draeger and Oneida. You like Oneida? All right, so an Oneida. You found an Oneida. $17,000. It doesn't even have a computer chip, does it? Maybe the monitor. That's insane, right? Am I just imagining it? Everyone wants to be a millionaire. So did you have a different option besides that?
Yeah. The guy that actually who
Stand by.
sold this one is gonna send me different prices. I'm talking about Monica.
Yeah, I know, but that's too much.
Yeah,
She's just trying to help,
Yeah.
but it sounds like
No, but
they're overcharging. So yeah, let's get a different quote and let's get that thing here. Get it purchased. What about talking to our biomedical sciences guys? What is it called? Come on, the guys that come and do everything. You know, the ones that check all of our equipment.
Oh, you mean right?
Right way.
Right way.
Yeah, do they have a machine?
They probably know people that sell.
No, why don't we talk to them?
Yeah,
Find
I
out.
can talk to Chris.
Yeah.
Yeah, usually, yeah.
Tell them what you're
I
looking
feel-
for.
yeah, sometimes I feel they're very expensive.
They may be, but you don't know until you find out, right? And they may give us a good price. Who knows? You know? If they like you. Have you been nice to them?
I'm nice with everything.
You're nice to everybody? I know you are.
That's probably my problem.
Ooh, this is a bone. This, by the way, is a bone spur, for those of you wondering. That's amazing. That thing is huge. This is a calcified disc herniation. Spur. And yes, the laser is able to get rid of it.
We have a question from Facebook.
Sure.
Are you allowed to take reps out for lunch?
Are you allowed to take reps out for lunch? That's a great question. I love the question. Can I get a seat? My legs are getting tired. Maybe that one? I got to sit down for this question. So the answer is yes, I'm allowed to take reps out for lunch. What's not allowed is for reps to take me out to lunch, believe it or not. It's the other way that's really looked down upon. The government and nobody wants to see reps taking doctors out to lunch, because they believe that if a rep takes a doctor out to lunch, then the doctor is going to be more likely to use that thing that rep's selling, like the product that the rep's selling. Okay? So it's considered what's called a conflict of interest. Conflict of interest. So it's really the reps that aren't allowed to take the doctors out. Now, does it happen? Probably. I don't do lunch with any reps. I haven't done lunch with reps or dinners or anything with reps in probably 12 years. The reason for it is when I was doing it, it was looked upon as okay. Nobody had a problem with it. That was 12 years ago. But about 12 years ago, maybe 13 years ago, they were starting to say, you know, it's not such a good idea. So that's when I just said, forget it. And prior to that, the rep was actually my friend. You know, we would go out to lunch in between surgeries or something, or in clinic days, and he would talk to me about new products they had. So he got an audience with the surgeon to introduce new ideas and technology. And of course, we went out to lunch, and he was making a lot of money. His name was Mark. He doesn't do it anymore. He's retired. But ultimately, you know, a lunch here or there, I don't think is a big deal. But I don't do it just because I don't have time anymore or an interest. I really don't have an interest in hanging out with the reps. Okay? Well, I'll be honest with you. When you're a poor resident, you don't have any money, you're in residency, it sure is nice to go out and have a nice steak dinner once in a while, paid for by a rep. And what I mean is like once a year. So when I was training, the reps used to take us out to steak dinner maybe once a year. Okay? And that's still done, and there's really nothing wrong with it, to be quite honest with you. However, it is sort of looked down upon. But there's nothing wrong with me taking a rep out to lunch. That, yeah. I mean, my wife would say there's something wrong, most likely, but aside from that, no, it's the other way around. You don't want an influence of the industry trying to sell implants, and the surgeon is the one who makes that decision about what implant to use. They don't want the relationship between the rep and the doctor to influence the doctor's decision about what to do for the patient. That's the idea. And I think it's reasonable. I think it's a really good idea, to be honest with you. Okay, because for somebody like me, honestly, I've got a little more morals and values, but I've seen a lot of my colleagues just totally sell themselves out for the reps. And I don't mean just steak dinners. I'm talking about other things too, which I won't go into a lot of detail with because I don't know who's listening. Like, there may be children listening, and it gets X-rated, believe it or not. Okay, I had a neurosurgeon I hired to help me years ago, and this guy was supposed to be a really good spine surgeon, and I was a really good spine surgeon, so I figured, all right, you know, he can help me get some of my surgeries done because I have too many to do myself. So I hired him, and he ended up putting in like one screw from one rep, another screw from another rep, and then a cage from another rep. And I'm like, I've never seen that done before. Why would anyone want to do that? And then I saw the reps, and they were all very attractive young ladies. And of course, I found out later that he was, you know, unfaithful to his wife, and he was actually cheating on his wife with these reps. And I guess one of them wasn't enough. He had to have 3 or 4. So long story short, first thing I said was, hey, how come I never saw those really attractive reps? They always sent guys to visit me, right? I'm joking. But yeah, it was pretty shameful and totally unprofessional. Needless to say, I fired the surgeon. Okay, and that surgeon is now operating in at least last I heard he was in Florida, up in, what's that place called? North of here, north on the coast. Not Daytona, north of Daytona. It's Amelia Island area. There's an area up there. What's that called? St. Augustine. Yeah, he's up there. And he's been up there. I don't understand how he's still in practice. He's screwed over so many patients. It was disgusting. When I found out about what he was doing, I was so angry because I actually had to go back in on several patients and try to correct what he did. And I had to call like 3 different companies, you know, to come in and help me get those things out. They were not working. They were failed. And they were just horrible products. So I definitely saw firsthand the influence of, you know, inappropriate influences of industry on surgeons. Not on myself, but on the guy I hired. So It's real. And yeah, prior to that, I didn't think it was a big deal to go have something, a meal or something with a rep. But after that, I realized there's just some doctors that just can't control themselves. You know, and it's better for the patients that there's no relationship with industry like that. Okay, we're done here.
Lights on, please. Have you discharged the patient?
No. No, the first patient, I want to see him before he leaves. All right, we're done here at 5-1.
That person on Facebook commented that they are
I can't, hold on, I couldn't hear you. Give me 1 second. Give me 1 second. Sorry about that. I'll take the question in just a minute. I know I've got all these weird stories of it. I've been doing this 26 years now. So you tend to see things in 26 years that other people may not see, you know? No, I don't. Thank you, though. So, all right, Diego, what was your question?
that same person said that they are regulated where she is, and they cannot accept anything from
Diego,
reps.
it's so hard to hear you.
Can you hear me right now?
A little bit louder and slow your speech down and enunciate.
Okay. How about now?
Again, just enunciate.
Hello? Yes? No?
Yes, we
Okay.
hear you.
Okay. That same person said that they are regulated where she is, and they cannot accept anything from reps over $12 without having it publicly declared.
Yeah. So whoever's talking like this may be a doctor, I believe, but they're saying that they're not allowed to accept anything from reps over $12. Once again, I honestly think it's probably a good idea, to be quite honest with you, and just try to eliminate some of the bias that has infiltrated healthcare and medicine, particularly when it comes to doctors choosing what's best for the patient. Now look at what I'm doing. I'm not putting any screws and rods in, you know? There are neurosurgeons that do back surgery for painful discs, and I was one of them for years, and I did fusions. I put lots of metal. I put literally millions and millions of dollars worth of hardware in people, okay? That was before I learned this technology. And when I saw how much better endoscopic surgery was, and we're not putting any hardware in people. We're not putting screws, rods, cages, plates, nothing. No biologics, no demineralized bone matrix, no BMP, nothing. This is all natural, in, repair, out. And if I was getting money from the implant companies, they would never let me do the surgery. Okay? They would never let me, because they would be like, why are you doing this? It's hurting our business. But see, I'm not beholden to them. I'm beholden to my patients. That's who I am here for. I am my first and foremost loyalty and who I'm committed to is my patients. Not the companies making hundreds of millions and billions of dollars a year selling the implants we put in patients. So a lot of my colleagues made easy money. Table up, please, or is your fluoro down? Can you drop the fluoro? Table up a little bit. Easy money. Like one of the guys I graduated around the same time he did. He's made $50 million promoting screws and rods at meetings. All the big meetings. All the young neurosurgeons look up to him. He's a big name. He's promoted academically by the academic centers, by the implant companies. They promote him, and then he promotes their product. So it's like they're hiring a sports superstar like Michael Jordan of Spine World. Some of these doctors, these certain neurosurgeons and orthopedic spine surgeons, they're like Michael Jordans, or I don't want to say Floyd Mayweather because he's such a dirtbag, but some of these big athletes like Messi, whatever, they're hiring them and paying them to promote and use their implants. And I tried to teach the surgeons about this technology, but they really don't want to learn it because it goes against the grain. It goes against the big industry and what the big industry supports, all the steak dinners. So I'm not part of that, and I don't want to be quite honest with you. When I'm free, I want to be with my wife and kids and my dogs. I don't care to spend time drinking alcohol and hanging out at bars and having my meals paid for. That's not really why I went into medicine. So I came into medicine to do the best for my patients. And that culture of the spinal implants and the fusions and the artificial disc, that's not what's best for patients. So that's why we broadcast, so people will learn the truth. You know, I've done many spinal fusions. I still do them, but I do them when it's totally appropriate or when the patient's insurance won't cover anything else but that. Okay? Take that. Shot. That's it right there. Shot. Mm-hmm. So if you want to do what's best for the patient, this is the surgery you do. When you want to do what's best for the surgeon, you do a fusion or an artificial disc or a laminectomy or a microdiscectomy. When you want to do what's best for the implant companies that sell those screws and rods, you do the fusion and the artificial disc. When you want to do what's best for the hospitals, you do the fusions. So it's all about money and what's best for the big people like the surgeons, the hospitals, and the implant companies, and what's best for them are fusions. And even the American Association of Neurological Surgeons are on the take. The Congress of Neurological Surgeons. These are the big neurosurgery societies. They're all on the take because they get money from these implant companies every year, about 10, 20, 30 million, depending on which neurosurgery society it is or orthopedic society it is. They get these sponsorships, they're called. I'll do it. Okay? So Medtronic sponsors the American Association of Neurological Surgeons every year, their annual meeting. They pay $10 million or so. Okay, and then the American Association of Neurological Surgeons lets the Medtronic be at the meeting and let them give talks about how wonderful the screws and rods are and how we should be putting more of them in people. Okay, that's what happens. And then when it comes to me being there and giving a talk, they let me give a talk, but only a small talk in the corner because my research and science is real. They recognize it. They don't want to get in trouble for saying no, but they also don't want anyone really to see it. So this game, you know, you can keep playing it or you can change the rules of the game. I changed the rules. I decided to go straight to patients and let them know what was really happening. Go out to the world, be public about it, be transparent about it, and let everyone know the truth. And that's why we have these broadcasts, is to promote the truth. Did I even answer the question? Honestly, yeah, you got me on a roll. That's what they call that, a roll. All right, I was rolling, right? All right, so we're going to finish this herniation, and then we're going to be done. Is there a rhizotomy? No? Yes, there is. Is there a rhizotomy on this patient or the next one? Next one. All right, sorry. Is magic. Oh, look at that herniation. Bajang. There's a lot of inflammation on that thing. Do you see all that? All that red? More of it. See all the red right there? See that red? It's kind of a pinkish color off to the left of the grabber. I know it's not in great focus there, but that's the granulation tissue. That's the painful tissue. That's not all of it. I got to go and look at it. Make sure I get as much out as I can. The more out I get, the less post-operative pain this patient has. But you can see the reddish, pinkish tinge to it. And there's a little bit of bleeding, but it's not much. Nothing to get excited about. That bleeding there is coming from, probably from the end plates. See the end plate to the right? At 3 o'clock, that pinkish thing? That's a bone surface. That's the top of the vertebral body. It's called the end plate. That's the superior end plate of L5. And this is the L45 disc, right? A lot of pieces of herniation. Anyway, we're all about truth in medicine here at Duke Spine. We serve the patients. That's it. I've gone to war with hospitals. I've gone to war with insurance companies. That's a big piece. I've gone to war with other surgeons. I go to war with everybody. Sometimes I even go to war with nasty, angry patients who come in with a chip on their shoulder and think that they can bully me or my staff. All right? Those are not the people I want to serve. But in the end, my duty is to my patients. And that's what I do. I do what's best for them. Okay? So, yeah, I've already done the pre-op, the timeout on the third patient. He's ready to go. We'll be done in 10 minutes, by the way, in case you are wondering. All right, here you go. 10 minutes, we'll be done.
We have a question on Facebook.
Yes.
Dr. Duke, if you had a herniated disc, what would you do for treatment?
Yeah, so if I had a painful herniated disc, what would I do? That's a great question. First of all, I would pray that it goes away without surgery first. But if it's not going to go away and I had to have surgery for it, there's one doctor I would trust to do the surgery. And he actually works here. That's the only doctor that would do it. He doesn't do laser surgery yet, but I'd have to give him a crash course. But he's utterly compassionate, incredibly intelligent, totally driven to be the best in his field, and just has all the qualities of a great person, just like Luis does. Yeah. If Luis was a surgeon with a license, he would be the one doing it, because he's done more of these than anyone else besides me. I mean, assisting me. But I think Luis and Dr. Patel, that's a team right there. They could do it. And I think I could go to sleep knowing I would wake up and still be alive at the end. Now, I mean, if it's thoracic, I don't know that I would. I guess no matter what. Cervical, wow, to me, cervical is just scary. I figured it out, but there's nobody else really that does it. So I don't think I would trust Dr. Patel to do cervical.
Yeah, the commenter is asking for a cervical disc.
Oh, cervical.
Yes.
Oh, I thought you were talking about lumbar. Cervical, wow. I guess I would have to teach Dr. Patel quickly. That's about the only person I would trust. And there's nobody else in the world that does it.
We have
Well,
a YouTube question.
Yeah, I was going to
Asking-
say there's a lot of red because obviously the bleeding. And the bleeding is just coming because this is a pretty degenerated disc and there's a lot of inflammation that's been going on for a long time. So that's kind of what we're seeing is the hypervascularity of this area. It's kind of a pain to deal with, but I apologize, you guys can't see it that well. Fortunately, I can see enough that I can do what I need to do. Yes, you can ask me the YouTube question.
That was what it was. It's if she's doing okay.
Stand by. So there's no additional question?
No.
All right, so let's get a good look at what's going on here. When you put this grabber in, you can actually see that's my problem right now. I got to get rid of that thing there at 12 o'clock. All right, so take this. Just a few more minutes. Doctor, unfortunately the bleeding here is making it a little harder and taking a little longer. Is there suction going on? No? All right, so what we can do here, I can try to reduce the amount of bleeding by just putting a cork on it. You like that, Luis?
Yeah, so actually I have.
I know, there's a little stopper.
Yeah, so
That's what that's for.
yeah, next time
I
I'll
know.
have it ready just in case that happens. Yeah.
I appreciate that. Egads. Any other questions from our audience?
No.
Two more minutes, I think. Standby laser, grabber. You can let recovery know that I'll be there soon. Is he ready to go home? Oh, that's a nice herniation right there. That was just wedged into the annular tear right at the back of the disc where the most painful area of the disc is.
Rita, can I have, when you're done with that, can I have the star shapes, the menso, everything, please? Thank you.
I need it again, grabber. Look at the blast marks around the tube, huh? Pretty cool. Those are all from the laser. Just banging, just melting the steel, surgical steel. So people say, oh, can lasers remove bone spurs? Absolutely. Yeah,
Yes.
no problem.
Do you think
What's
I'm
the
gonna
issue?
need, no issue. Do you think I'm gonna need
Laser on.
a solution for this one?
Luis, whatever you think. I think maybe, yeah.
Yeah.
Flat, because she was on the aspirin.
Yeah, no problem, no problem. Yes, please. Yeah, thank you very much.
All right, let me see the grabber again. Take that. I'm having to introduce the grabber just to get the fluids to stop moving so I can see what I'm doing. We're just about done. That should be the end of it. It's almost like a shaving motion, you know? Shaving this thing down. Stand by. One more minute, I think, and we should be there. All right. So if you watch the first surgery we did today, we did a 5-level laser. We did 2 thoracic herniations, laser repair, and we did 3 lumbars. And that patient's already ready to go home. And they've been waiting for me to finish here. And we have one more surgery to go after this, and we'll be done. All right, just gonna get that and done. All right, done.
Alright. Right now, please, everything on, please. Pop off.
Scope off. Everything's okay. You're just waking up. You're fine. Good timing, doctor. Perfect timing. All right, so let's show everybody what we just did. The entire surgery was done with a small incision. By the way, this is what the herniation stuff looks like. That's the nucleus pulposus. It's not normal. You see it right there?
Yep, we can see it.
That's not normal nucleus, that's degenerated nucleus. That's why it stains blue. All right, but we did both discs through this tiny little cut right here, 7 millimeters. We're gonna apply pressure for about 3 minutes, 4 minutes more, and that'll stop any venous bleeding. Break down the scope. I'll help you out. So those two discs were repaired with a 7 millimeter incision, outpatient procedure. How old is our patient?
She is
71 years old, and she's going to go home in an hour because she just had outpatient surgery. Good job, everyone. I've got a Raytech off the field. If you have questions for me, folks, type them up, and I'll come answer them for you in about 3 minutes. Why don't you run a nice little video for our viewers? I'll be right there.
All right, we're clearing for takeoff. There we go. This is how normally I'm running, about like this. I've got my arms out. Like I said, after about an hour, it was getting excruciating pain just going across my back. And he's fixed all that. As long as that's fixed, I'm ready to go. Years ago, I used to run motocross, cross country, did a lot of different things. But one of the biggest things I did was had a bad motorcycle wreck during that, and did a end over the handlebars, and basically planted my head straight into the dirt, and it jammed top of my neck, messing up 3 herniated discs. So I've been dealing with that for 30 years. Seems like a long time for me once you're living it. And finally, it just got to be so bad at the end, especially when I go to drive the RV. As soon as I hold my arms out for the matter of an hour, just the way the steering wheel is positioned on the RV, it just sends excruciating pain across my back. Gets down to my hands where my hands are numb. Me and the wife, we have to pull over, rest stop. After 2 hours, it's incredible. I just got to get up, take a break, shake my hands. Well, if you're going on a long trip, All right, we're clearing for takeoff. There we go. This is how normally I'm running, about like this. I've got my arms out. Like I said, after about an hour, it was getting excruciating pain just going across my back. And he's fixed all that. As long as that's fixed, I'm ready to go. Years ago, I used to run motocross, cross country, did a lot of different things. But one of the biggest things I did was had a bad motorcycle wreck during that and did an end over the handlebars and basically planted my head straight into the dirt, and it jammed top of my neck, messing up 3 herniated discs. So I've been dealing with that for 30 years. Seems like a long time for me once you're living it. And finally, it just got to be so bad at the end, especially when I go to drive the RV. As soon as I hold my arms out for the matter of an hour, just the way the steering wheel is positioned on the RV, it just sends excruciating pain across my back, gets down to my hands where my hands are numb.
I love the
Me and the wife, we have to pull over, rest stop.
Yeah, the nerve.
After 2 hours, it's incredible. I just got to get up, take a break, shake my hands. Well, if you're going on a long trip, 2 hours don't get you very far. Just like lifting up this, I was having a hard time getting into my engine compartment. Just every little thing that you take for granted seemed to become a bigger problem and bigger problem as far as my neck. I went to Dr. Duke's to try to
Especially
get
on a
fixed,
molecular
and
and
he did
biochemical
an
level.
expert job. Looks pretty good. Fixed it all up for me. Went in through my neck, went around to hit the back of the spinal cord. I still don't know how they do it. Unbelievable. But no scars. Didn't hurt at all. As you know, when I woke up, it was totally painless. My surgery was done on a Thursday. I went back to work Monday. Pretty awesome. Once I've gone to the Duke Spine Institute, it's amazing. Once you take that pain level down, it's like, whoa, there's nothing. I mean, it's night and day. I mean, I just can't even describe it, how good it is. You know, I feel like a new man again. Now that I'm back driving the bus again, it is fantastic. Now we can get behind the wheel, drive for a good 8-9 hours, and then take a rest where I want to and not where I have to. What a difference. Fellas, I'm telling you right now, if you've got the pain I've got, you call me. We'll talk. Anybody can call me anytime. 321-403-8757. We'll talk about the pain. If you've had this, you're going to want to get rid of it. What a great place right here in Rockledge, Vieira, where we can get rid of it right there. I wish I had known this years ago, but I did Duke Laser Disc Repair. It was great. My name's Randy Quick, and if I have anything else, I know where I'm going. I'm going to Duke Spine Institute. All right, we're clearing for takeoff. There we go. This is how normally I'm running, about like this. I've got my arms out. Like I said, after about an hour, it was getting excruciating pain just going across my back. And he's fixed all that. As long as that's fixed, I'm ready to go. Years ago, I used to run motocross, cross country, did a lot of different things. But one of the biggest things I did was had a bad motorcycle wreck during that and did a end over the handlebars and basically planted my head straight into the dirt, and it jammed top of my neck, messing up 3 herniated discs. So I've been dealing with that for 30 years. Seems like a long time for me once you're living it. And finally, it just got to be so bad at the end, especially when I go to drive the RV. As soon as I hold my arms out for the matter of an hour.
2, 1.
Okay, how's everybody today? I hope well. We just wrapped up a 2-level, that's an L45 and L5S1 Duke laser disc repair. Our patient had 2 herniated discs in her lower back. She's had pain going on for years in her back and down her leg. Didn't know what to do. Nobody else could fix it for her. She found Duke Spine Institute, found out about Duke laser disc repair. We just completed the surgery, and her pain in her back and leg will be gone, is what I predict and what I expect. Our average pain relief is about 98-99%, so 98.5% across the board. We've not had anybody that had the surgery that we didn't get rid of. Usually on the first day after surgery, it's 100% for everybody. I've not seen anything lower. Sometimes 95, but our average once again is about 98.5%. So if you have back pain or neck pain and you've been living with it, you have herniated discs, and those herniated discs are causing the pain, that's our job to figure that out, by the way. We can do a free MRI review and a free telemedicine or Skype, where we can sit down and do a video conference, and within 10-15 minutes we'll have a plan for you. We do all those services for free at Duke Spine Institute. Anyway, our patient is out of the operating room now. She's in recovery. The first patient we did today, he is leaving with his daughter now. He is up walking around. He's a little groggy because he was under the anesthesia for a while, having the sedation for a while. So he's doing fantastic. He's happy. He says he doesn't feel any of the pain that he had before surgery. So tomorrow we're going to get a video of him when he comes back for his checkup the next day. And once again, he has no pain medications on board besides the one he came to us with and the ones he's had for quite a while. All right, since there's no questions, we're going to wrap this surgery up, and we'll have one more surgery, which will be another L45, L5S1 Duke laser disc repair.